Hello, this week we're talking about plantar fasciitis and how to treat it, but first, our disclaimer. Dr. Mike Matthews, physical therapist here with the PT411. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, Instagram, TikTok, and Twitter. Also, make sure you check out thept411.com. So like I was saying, this week we're talking about treatment of the plantar fasciitis, but before we jump into it, one thing I do have to say, and it drives me completely bananas, is the name plantar fasciitis. It's an old, outdated term, old and very, very outdated diagnostic term that we use. It is non-inflammation, as the name implies. Itis, I-T-I-S, at the end of the name usually implies that it's an inflammatory issue. This is not an inflammatory issue. It is a direct injury of a piece of tissue, and yes, sometimes inflammation may be a part of this, may accompany this, as inflammation always comes in at the first step of healing for anything. But the main issue is an injury of actually tissues, so I would call it more of a fasciopathy, an injury, an issue of the plantar fascia there. And since it's not an inflammatory issue, it's not going to simply just be treated with RICE, the rest, ice, compress, elevate. That's not going to work. It might help to tone down the pain and make it more manageable at times, just taking the edge off, but it's not going to fix the problem. It's a tissue and we have to load it. But don't get me wrong, sometimes we do need to take the edge off there. Sometimes we do need to decrease that pain because it can be a fairly debilitating and severe issue. Using our hands to massage it, or rolling a ball or a frozen water bottle underneath our foot to massage it, to just kind of work it out, just to take the edge off, like I said. But these are not going to fix the problem. We do need a little bit of relative rest right after the injury, but within a couple of days, we actually do need to start loading this, and there's a few things to do to load this. But before we jump into loading this sucker up, I did make a few videos on things that commonly cause this issue. I did a video on how we can walk properly. I also did a video on leg length discrepancy, as well as a video on hip drop and gluteus medius weakness. So if you haven't seen those videos, make sure you head over to YouTube or the pt411.com so you can check those out. So we're going to go over the two most researched, the two most heavily based, evidence-based exercises to load this thing up. And we're also going to go over two helpers to ensure that we are loading this up properly in the first place to reduce our risk of injury. But first, let's go over how we can actually treat an active plantar fasciitis. So the first thing that we're going to do here is we're going to cross over our ankle on the opposite thigh while we're sitting. We're going to need to stretch out. We're going to need to really stress out this tissue right here, this plantar fascia. So we got to get this dorsiflexed at the foot, and we need to get our big toe flexed up as well. Oftentimes we need to get the other four toes going as well, so it's good practice just to grab onto all five of those. So we're right here, we're stabilizing with our hand on the same side of the thigh, that's down, and grab onto the big toe and all those fingers. And we're just working on dorsiflexing there. I'm going to change my angle up a little bit. We're just coming up this way, giving it a nice, good pull. Now we're going to hold this stretch up here for 30 seconds. We're going to do this 3 sets each time we're doing it, and we're doing it 3 times each and every day here. Now the next exercise, we're going to get you up on your feet. We're going to do some heel raises while our big toe is cocked up. So the big thing we're going to need for that one, to ensure that we're doing that one properly, we're going to get a towel, we're going to roll it up, and it doesn't need to be anything big at all. We're going to place it on the ground, and then we're going to put our big toe on top so that it's cocked up into that dorsiflexion we're talking about. We're just going to do some heel raises from here. We're doing this one 30 times, 3 sessions each and every day. To progress this a little further, we want to let this heel drop down a little bit more. So you want to be on a little bit more of an elevated surface, so that you're starting down a little bit further with that heel, but to the same result at the end, raising up and down. And you'll notice I'm doing this with one foot. If this is too difficult, you're starting off with both feet and eventually progressing to that one foot there. Once we get to the point in time where this isn't painful, we got to start actually just doing some hopping on it. When we're hopping on it, excuse me there, And when we're hopping on it, we start off with both legs. We're gonna do just short little ankle hops. We're gonna do our 30 repetitions at a time, and when that gets easier, we're gonna switch over to one leg. When that gets easier, not painful, we can start to get back into our jogging, build it up to those sprints if we need to, or more sport-specific training as we need to there. Now, we also talked about working on 2 helpers to make sure that we're using this properly in the first place. The first big thing, we gotta make sure that big toe has really good mobility coming up this way. We have what's called a windlass effect, and that's the effect that actually uses this plantar fascia to keep our foot nice and stable. Now, as long as we have good mobility in that big toe right there with that dorsiflexion coming up this way, it's going to put the proper amount of tension throughout that plantar fascia. It's going to keep this entire foot nice and stable when it comes time to push off. We really need to make sure we have good mobility in this MTP joint right here. Let's say that it's not going back all the way, or we feel like we're pretty limited there, because there's a good amount of motion right there if you were to take a look from right here to right here. If we're nice and limited here, we got to start stretching that sucker out. As far as joint mobility goes, we need to actually put slack on that plantar fascia. So we're going to point our big toe down this way, and we're going to work on the joint coming up here, because you'll notice I'll have a lot more mobility here than when I have up here. And if this joint is nice and limited, there's no way I'm going to get to stretching it out and mobilizing it if I have my entire foot dorsiflexed over here. So we're plantar flexing it down, pointing our toes down as we come up this way. This one is a joint, it's a repeated movement. You're only holding it for a couple seconds at a time, but you're gonna do this one several times a day, 6, 7 times a day. And you're doing 30 repetitions each time you work on it. And like I said, we've got to do this one several times a day, every few hours if possible. I know life gets in the way when we can't, so try to make up for it when you can, but we got to keep that first joint, that first ray function and mobility nice and loose, so that we can make sure that that plantar fascia is catching exactly where it's supposed to be and keeping it nice and healthy there. The only other helper that we have left is a simple calf stretch. We don't have to make it any more difficult than it needs to be, so don't get any fancy equipment to try to work this out. All you gotta do is stand up, and we're gonna place the side that you're stretching out in the back. You gotta make sure you keep that knee straight the whole time, and you're just lunging forward onto that other foot there. This one's a muscle. We're stretching out for 30 seconds, 3 sets, doing this 3 times a day. And if you're not getting a good stretch out of that, you grab an elevated surface or get up to a step. We'll elevate the front of your foot there, and we're gonna do the same thing, knees straight. So that's it for this video. Next week, we're gonna talk about this injury a little bit more and a few other strategies that we can try to help treat this, so make sure you stay tuned there. Again, I'm Dr. Mike Matthews with the PT 411. Thanks for joining me.